Namaste. Greeting to all the delegates of 8th Annual Summit of NATHEALTH. It's been really wonderful to recollect how we wanted to bring in the entire health force together under one roof and take this opportunity to see what are the possibilities that health can alter the way health is available, affordable and accountable to people. That was my dream 8 years ago when we started NATHEALTH. Today I'm glad things are coming together. So I must compliment the President and his team, Dr. Mahajan, Dr. Siddharth Bhattacharya and his team, and the entire members who have joined together from the various healthcare identities, what today NATHEALTH is. And I'm very happy today. It's also an important day when we are now going to work with Global Association of Physicians of Indian Origin, GAPU, which again will give us an opportunity to interact with healthcare community across the world. So I really want to congratulate the NATHEALTH organization for attempting to address healthcare. None of us can forget what we all went through in the last 2 years. A pandemic which was so devastating, never ever expected, but the manner in which the entire health force, the government, the way it was all handled across the world, I think is commendable. What I personally want to first give is my appreciation for the entire health force, whether they are in the government or in the private, for the great work that they have done in such times when people were panicked. Here are the doctors who worked on the clock. I know what we have seen in all our hospitals. I know my pharmacists who during lockdown went home and delivered medicines for people. So I think this is, and people who worked in the intensive care units. I think it's remarkable what the country has done, and I have great compliment for it. Whatever COVID has done has also done a transformation in the way healthcare is going to be for tomorrow. Because we were really looking at it, from the warning that World Economic Forum gave, saying that by in 2020 to 2030, the world will face a new big threat from non-communicable diseases. What are these? Diabetes, heart attacks, strokes, cancer, infections. And I add 2 more to this 5. That is overweight, obesity and mental disorders. These 7, according to World Economic Forum, way back a decade ago, they said that 80% of the deaths by 2030 will be from these non-communicable diseases, and the cost burden is going to be $30 trillion for the world, and for India it's $4 trillion. I mean, $4 trillion. Can you imagine $4 trillion? I'm happy we have the Secretary of Health, Mr. Rajesh Bhushan there with us today, and Prathap, CEO of Niti Aayog. They will understand what $4 trillion for India is also going to mean even during 2030, almost 50% of the GDP. I know what I went through in the last 3 decades, trying to take the health expenditure from 1 to 3%. So where do we think about 50%? Forget whether we even can afford this $4 trillion. But the families cannot afford this. Because who are these people who are going to be lost during the heart attacks, the strokes and the cancer? It is the most crucial member of the family. The breadwinner of the family, the happy factor of the family. And he is the person who is now responsible for the country's growth. And it's they whom are going to lose. Because heart attacks and strokes, unlike in the West, they don't occur in the 60s and 80s in India. It used to occur between 30 and 50s. Now it's occurring in 25s and 40s. So who are these 25, 40s? These are the breadwinners. These are the people who are keeping the families happy. And even if we can afford the money, we certainly cannot afford to lose them. So I think we need to look at saying, how do we now transform ourselves to meet the new healthcare challenges? That should what not health, because we have a force today which previously did not exist, because each of these healthcare components work differently. But I'm happy we have all come together in NATHEALTH, and today I think we can take any challenge, and the challenges are going to be very rewarding. If suppose you control these non-communicable diseases, and I believe we can, if you make people realize that their health is important as much as their all other professions, they must also look after their health. And what I'm talking about is, personalized preventive health. If they have personalized preventive health, I can assure you that the so-called 80% of the deaths from non-communicable disease can be drastically brought down into single digit instead of 80%. And fortunately for us, we also have other developments which have come into healthcare, like the artificial intelligence, datamatics, robotics, 3D printing. All this will make a significant impact in giving precision medicine, precise diagnosis and precision medicine for the people. This is what really we are looking for. And I think it is a great value addition. But I must say this should be one of our top priorities not for the government, not for the healthcare people alone, for the people at large. They will think, my health is very important for me, my family health is very important for me, and all that I need is to find out what is my status of my health. Can I prevent any this so-called non-communicable disease? Because it is no longer a threat, it's happening. 65% of the deaths today is from non-communicable diseases. So we need to address this issue very urgently. And I think this organization, NATHEALTH, can really spread this message. Second, as I said, the technology will make a significant impact in earlier diagnosis and precision diagnosis so that patients will get better and the best care. Finally, we should also look at the dreadful things that healthcare is going to face. But we must also realize the healthcare can be a very attractive thing for the nation. I want to mention two things. One, today, in Indian healthcare today, we can proudly say whatever is happening in the majority of the hospitals in our country is what's happening in the best hospitals anywhere in the world. And more importantly, not only giving the clinical excellence, but we give something which you can't buy with a juice box or a dollar. This is the care and compassion. So I think Indian healthcare, with our clinical excellence, with care, compassion, and a big cost advantage, could be a major factor in driving people to India to get their health care in the country. I used to use the word saying, India is now ready to become the global healthcare destination. But I think I've been rightly corrected to say, Dr. Reddy, don't forget that yoga has been accepted by 170 countries as an International Yoga Day. So when they think of India, they should think also of yoga, meditation, naturopathy. If you add this along with the clinical excellence and of the hospitals and say they are in the hospital for 10 days for the treatment, go for another 2 weeks, this rehabilitation program, and come and take a final advice. It will be a tremendous thing. Nowhere in the world can you get this. And now there's another bigger possibility, which is also very essential. The healthcare around the world, including India, we are deficient in health workforce. But the world by 2030 needs nearly 40 to 45 million healthcare workers. Which country can give it? The West cannot. As it is, they are deficient each year by 10%. So previously, Philippines and all used to give the nurses. One advantage India has for a long time to come is that we have this young population whom if we can train into health forces, doctors, nurses, paramedics, pharmacists, managers, all of these people, home care workers, all of this will be a great advantage. But I'm very happy that NATHEALTH is doing many wonderful things to putting all this together to make India a healthier, happier, and a wealthier country. God bless.